when estrogen is in your body, normal and in balance, we're fine. But if it's too high, how would that cause migraines? If it's too low or it's fluctuating down, how would that cause migraines? That's the part we should know because that's how we're going to understand how to treat the individual. The role estrogen plays in the production of something called monoamines, and you know them as serotonin and melatonin, is well established. Estrogen plays a role in the production of your ability to make serotonin and melatonin. The thing about serotonin production and estrogen fluctuation is, and that's often seen in people who have PMS, when there's these fluctuations of estrogen and you're super physiological, these fluctuations in estrogen will affect your ability to make serotonin. Now, serotonin, you see that with your mood, with depression, with PMS. When the patient has these fluctuations and the serotonin goes low, it isn't always depression though. See, serotonin deficits are not always what we think. We're learning that from our news, or the media when we see these advertisements, serotonin for depression. That's all we've been taught. But let me tell you, there's more. Serotonin deficits also trigger migraines. Sometimes you don't have to go any further than looking at this one thing. There's the triptan class of medications out there for migraines. Many of you have taken them. And the triptan class of medications are named triptan for a reason. It comes from tryptophan. So this is the thing. When you eat, and you eat food that has protein in it, protein, hopefully there'll be tryptophan in that food. Tryptophan gets in your body and it's in circulation. Now, tryptophan is a building block for many things, but one of the things it's important building block for is serotonin. Tryptophan will cross the blood-brain barrier, and in the brain, it gets converted to serotonin, then serotonin and melatonin. So when you have a patient that has these fluctuations of estrogen, a lot of times you will inhibit the production of serotonin. So they give you the triptan class of medication to bypass that. In my mindset, that's not enough. That's not quite the best approach. Because again, hold on. In the clutch, to prevent pain, yes, this is not a bad medicine to use. But long term, I really should be getting a better solution on hand than giving you this triptan class of medicine.